Welcome to The Explainer. Today, we're tapping into a pretty amazing medical diagnostic technique.
It's called clinical percussion, a simple but incredibly powerful hands-on diagnostic tool.
Percussion lets us basically hear what's inside by creating 4 very distinct notes.
Okay, so let's start with the 2 sounds that have to do with air in the lungs. A resonant note is exactly what you want to hear. It means a healthy mix of air and tissue.
But a hyper-resonant note can be a red flag for conditions like emphysema or pneumothorax.
All right, now for the sounds you'll hear over solid organs and trapped gas.
A dull, kind of thud-like sound, that's totally normal over a solid organ like the liver.
But if you hear that dullness in the lungs, that could mean fluid or even pneumonia.
Then there's a tympanic note. It's drum-like and what you'd expect over the stomach.
So how do we put these notes into practice? Let's look at a technique called tidal percussion.
Don't worry, it's a really simple and elegant 3-step process. Let's walk through it.
First, you'll tap down the chest to find exactly where that resonant lung sound turns dull.
Next, have the patient take a deep breath, hold it, and you tap that exact same spot again.
And here's where it gets interesting. It's all about whether or not that sound changes. If that dull note becomes resonant, that's a positive, totally normal result.
It just means the lung border moved down as it should, usually about 4 to 6 centimeters.
But if that spot stays dull, well, it means something's blocking the lung from expanding.
That something could be fluid from a pleural effusion, consolidation, or even an enlarged liver.
It just goes to show, a simple skill like this can give you critical clues right at the bedside.